So, Dr. Lim, could you tell us about the advice to prevent cancer?
We can prevent the cancers if we know what is the cause of the cancer, and we can do something to the cause of the cancer. For example, we know the majority of the liver cancer caused by hepatitis B infection, the carrier state. Because we know that, we started the hepatitis B vaccination program many years ago, and those without hepatitis B, or rather those with hepatitis B infection, the chance of getting the liver cancer is 100 times more than those who are not hepatitis B carrier. So in fact, those without hepatitis B carrier state, they seldom get liver cancers. For lung cancers, the major cause is smoking, and smoking. We know that worldwide, about 80% or more of the lung cancers are caused by smoking. In fact, less than 100 years ago, lung cancer was one of the rarest forms of cancers. The reason why lung cancer has become so common is the start and increasing prevalence of smoking after the World War I, World War II, where smoking has. So the best way to prevent lung cancer actually for never smokers is not to start smoking. We also know that for smokers who are at a higher risk of lung cancers, by stopping smoking, the risk of getting lung cancer can actually reduce. So the best way to prevent lung cancer is, number one, if you do not smoke, don't start smoking. If you are a smoker now, stop smoking, and your risk of lung cancer will start reducing, and over time, the risk of lung cancer of a smoker after stopping smoking will approach a never smoker.
Thank you, Dr. Lim. And how is your thinking about some advice on prevention for cancer patients?
So, I mean, what Dr. Lim says is true. Prevention is still better than treatment itself, and it's still number one cause of lung cancer is still smoking. And in many parts of the world, smoking trends is going up, especially among females, because many females now, young females, are smoking for many reasons. Because one is fashion, the other reason is to lose weight. There's a perception that if you smoke, you can lose weight because it spoils appetite, and so that's very important, because although initially it was uncommon among females, but now more and more females are getting it because they also start smoking. So prevention is very important. So stopping smoking is very important. But one thing you have to understand is, as Dr. Lim said, that once you stop smoking, the risk doesn't come to the same as a risk as a non-smoker immediately. It takes at least 15 years. But every year the risk gets lower and lower and lower. But what about those patients who are already heavy smokers who want to stop? And you can stop, and there are many ways to stop it. You can use nicotine gum. Because one of the things of smoking, you stop smoking, is a lot of patients get withdrawal, and so they have to go back, because it's like a drug addiction. So the moment you stop, there's a withdrawal symptoms they get, very bad symptoms, so they have to go back. And the main reason for getting withdrawal is because of the lack of nicotine. So there are many ways to overcome this withdrawal. They can take nicotine gum, nicotine patch. There are many methods. They can see the doctor who can advise them. That's one thing. So the other thing is, at least once they stop smoking, for the next 15 years, until they come to the same risk as a non-smoker, they're still at high risk for developing cancer. So this is the group of patients where people are recommended to go for lung cancer screening. And the way to go is to go for a low-dose spiral CT scan. So I just want to add on to that.